Welcome to my channel, Brainies. In today's video, I'm going to talk about the Tourette Syndrome. What is Tourette Syndrome? It is a disorder which can cause the uncontrollable movements and vocal sounds called tics. It usually occurs in early childhood and improves in late adulthood. Tics can be even milder or severe. It involves two types. One is called as motor tics and the other one is called as vocal tics. Motor tics involves the body movements like shoulder shrugging. The vocal tics involves the voice like throat clearing, etc. What are the other types of tic disorders? The first type is the provisional tic disorder, which involves the motor or the vocal tics, either one or both, for less than a year. The next type is the persistent, that is the chronic type of tic disorder, either motor or vocal tics, not both, for more than a year. The next comes the Tourette syndrome, which involves the motor and vocal tics both for more than a year. The causes of Tourette syndrome. It is actually speaking, it is idiopathic. The exact cause is not yet been known. It's a complex disorder which is caused by the combination of inherited, that is the genetic, and the environmental factors. The chemicals in the brain which transmits the nerve impulses like the neurotransmitters, including the dopamine and serotonin, it plays a crucial role in this Tourette syndrome. What are the risk factors for this particular Tourette syndrome? The first one is a familial history, it also increases the risk of developing it. And the next one is the gender based. Males are much more 3 to 4 times more likely than the females to develop this type of syndrome. The symptoms of the Tourette syndrome. It usually starts between the ages of the 5 and 6, reaching a peak of around the 12 years. Tics can be complex or the simple. The complex tics involves many movements and muscle groups. Jumping is a complex motor tics. Repeating certain words or phrases is a complex vocal tic. Simple tics. These are quite quick, repeated movements that involves only for the few muscle groups. For example, it can be shoulder shrugging is a simple motor tic. Sniffing is a simple vocal tic. Certain examples of tics. Let me just tell you about the motor tics examples initially. The motor tics are arm jerking, bending at the waist, eye blinking, head jerking or twisting, hopping, jaw movements, twisted or distorted facial expressions. Examples for vocal tics are barking, grunting, shouting, sniffing, throat clearing. So, regarding the diagnosis of this Tourette syndrome, there is no specific diagnosis for this tic disorder. The tics must have started to diagnose this. The tics must have started before the age of 18. So, patient should have been experiencing both motor and vocal tics for more than a year. So, there's no specific blood test or imaging examination to detect Tourette syndrome. Instead, the healthcare provider can carefully review the medical history and the symptoms and may ask certain detailed questions about the tics, like how often the tics happen, at what age does it started, and what is the nature of the tics, whether it is going to be simple or complex, all those questions. Based on this, we can just come to a conclusion what type of tic it could be. But however it is, there's no specific diagnosis as such, as investigation as such, to detect this type of Tourette syndrome. The intervention, one of the main intervention includes the comprehensive behavioral intervention for tics, shortly been abbreviated as CBIT, which is first one is responding to tics. Doing a new and different action when the tic occurs is a competing response. For example, a voluntary action like shutting your eyes limits the involuntary action, that is the blinking. The next one is recognizing the tics. Some patients or people feel a sensation right before the tic occurs. That is, priorly they could feel it, that we call it as premonitory urge. So, by recognizing this urge, they may be able to mask or suppress the tics. The next one is reducing tics. One of the best way of reducing tic is actually speaking the excitement or anxiety tends to make the tics worse and makes it to get increased. So staying calm and composed and avoiding stressful situation may reduce the frequency of tics. That's it with my video. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.